Hi, welcome to Your Health Matters. I'm Scott Kern. We've got a great show today talking about community partnerships with KRMC. A lot of people don't know that Kingman Regional Medical Center is part of the Mayo Clinic Care Network. And we've got Steve White here today, the director of our cancer center, to talk to us about all the new things that we're partnering with the Mayo Clinic about. So stick around, we'll be right back. We're going to talk about some great fun things. Hi, welcome back to Your Health Matters. I'm Scott Kern. We got a great show today with Steve White talking about the Mayo Clinic Care Network and how they're partnering with KRMC with a lot of our other programs. Steve, thanks for being on here today.
Thank you.
So, the Mayo Clinic Care Network and KRMC have partnered together on a variety of projects. We've been a member for 3 years now?
I believe that's correct, 3 years.
Mm-hmm. So, and you are the director of our cancer center currently. So, you were telling me before the show about a partnership we just formed with the Mayo Clinic with the Cancer Center. Can you tell me about that?
Certainly. We had a very good kickoff meeting last week with Mayo. 4 of their oncology doctors and 3 of their administrators came up, and we outlined our program, what we're doing, and they did a tour of our cancer center, and they are coming up with some recommendations for quality improvements. And so we call our partnership knowledge sharing program.
So it's a knowledge sharing program with Mayo Clinic.
Our doctors will have access to their doctors on any tough cancer case or need help with any special project.
So that's pretty cool. So KRMC will have essentially all the access to the Mayo physicians for all of our cancer patients here, as far as cancer goes.
Right, and not only just with the cancer patients. If they have to talk to another specialist, like a GI doctor or a neurologist or something, they also have access to those doctors under our network.
That's pretty exciting. I do know that we were hospital number 2 under that network, and last I had heard we were 2 of, I think there's 37 total hospitals and
correct.
Growing.
That's correct.
So it's pretty exciting, especially having the Mayo Clinic down in Scottsdale. It's almost like they're in our backyard, so we get a great opportunity for them to come up and kind of help us out with the cancer center, like you said. They're sharing with us a lot of tips that they have in their programs and kind of helping us streamline ours. So that's pretty exciting stuff.
Yeah.
Now, as far as the background goes with this, what prompted this to form this partnership with the Cancer Center? Was it just the need in the community was growing so much that we needed the partnership with it, or?
Yeah, that's part of it, and we've had some growing pains with our cancer center, as you know, but we are comprehensive. We do both medical oncology and radiation oncology. And so to have a full comprehensive program, we decided we needed some outside help to look and see where we can improve our processes, like patient flow, chemotherapy, patient wait times, those kind of things, to make it easier on the patients to receive their treatments.
Okay, that's very helpful for the patient too, because it reduces the patient's stress having to go through the process when it's choppy, if you will. When it's smooth and streamlined, like I've heard the Mayo Clinic they're very good with keeping the patient on task, if you will, about everything. So that's a great program to have.
Yeah.
Now, a lot of people don't know that you've been with KRMC for a long time. You're actually one of the guys that helped bring the Cancer Center to KRMC back in the 90s, correct?
I was fortunate to be the facility manager for KRMC at that time and was part of the construction project actually building the Cancer Center.
So that's pretty cool. So you really know all the ins and outs of the Cancer Center then?
I did.
You did. I guess if we can go back to the 90s for a second, and if you can recall some of that, what were at the times? What were some of the innovative things that we did that we were bringing to Kingman then? Because we were still pretty cutting edge with our cancer center back when we opened, right?
Well, before we opened the cancer center as we have it now, we did have a small chemo unit that was located over in our medical professional building on the first floor, and we were doing chemo infusions and those kind of things. But we weren't offering a full range of medical and radiation oncology. When we built the new center, we were able to build what we call the vault to house a linear accelerator, which provides the radiation treatment, and a new infusion center for the medical oncology. And we currently have 12 stations where we can provide chemotherapy in one private room for a patient that has to be laying down when they receive the therapy. And we have one accelerator, and with planned for an extension, we could add another when the volumes and the community need.
I have to imagine that we're probably getting pretty close to those volumes with the amount of. I know every time I walk by the cancer center, it's packed. I mean, there's a lot of patient care, which is great. That means people are getting treatment. They don't have to go far from home. They can stay here locally, which relieves a lot of stress. I know my dad had cancer when I was a kid, and we had to go to Vegas for treatments for the type. So having it right in our backyard is so much easier to have.
And that's key. And but to do that, you have to have a program that people have confidence in. And I think with our partnership with Mayo and our new physicians that we have on board now, we're going to meet those expectations for the community.
Absolutely, and you bring up a great point. We have 2 new physicians starting. We have a new oncologist and a new hematologist starting here at the hospital very soon. And that's pretty exciting to get. It's always exciting for us to get new doctors, but it's always exciting to get doctors with these kind of specialties, because once we have these specialties in place, especially the cancer center, we can grow. And we can grow at a pretty fast rate for patients, and we can attract patients from all over the county and hopefully Vegas too, because of the cutting edge technology and the partnership with Mayo. Now, with this Mayo partnership, are we going to have the doctors come up on site occasionally too to help out, or are they strictly just consulting over?
I'm not exactly sure if they will be coming up on a regular basis, but on a special as needed basis that could be arranged. We will be myself and my the oncology supervising nurse will be visiting the Mayo site and watching their operation and bringing best practices back up to our clinic. But I believe with our e-consults, we can electronically submit data to those doctors down there, and within 48 hours they respond back with their opinion on that question. Yes.
That's pretty exciting. And, and I mentioned it earlier, but if you've never been to the Mayo Clinic before, they're a very streamlined process. They're very schedule oriented. You know where you have to be when and where from the time you walk in until the time you walk out. They do a great job with that, and I think them implementing that program into the cancer center will help us streamline that to maybe eventually work it out in other programs we have here in the hospital.
Yes.
I mean, I think that would probably be one of our ultimate goals.
Yes.
So that's very exciting. And you had mentioned we have 2 new physicians in the cancer center starting, or that have started with us. That's Dr. Edgardo Rivera, and he's our hematologist.
No, Dr. Rivera is our medical oncologist. And the second doctor is Dr. Valerie Israel, and she actually starts practice the 1st of March. She's currently in Lake Havasu.
Okay.
And she'll be moving up here. And she is a hematologist and a medical oncologist. She'll be working with the blood disorders.
Okay.
And she's also lung cancer expert.
Very nice. I understand we also have a lung nodule program starting, screening program starting, so I'm sure she'll be very key in helping with the lung cancers there. And
the earlier we detect those nodules and the earlier we get treatment and the better the chances are for recovery. Yeah.
So it's a lot of exciting stuff coming to the Cancer Center and KRMC, which is cool because it's an exciting time for Kingman medical wise, because we've never had this much, I guess, momentum to be able to help people in the early stages of whether it be lung cancer or any other form of cancer before. I mean, we've had some great doctors working with us in the clinic years prior. Not to take it away from them, but for this partnership with Mayo, it seems like it's a pretty fantastic time if you're going to get the unfortunate task of having a cancer, at least you can be treated with comfort and care and the best practices here at KRMC with Mayo Clinic. So Dr. Rivera has started here, though.
Dr. Rivera's been here for about, I think he's in his 4th week now, and he comes very highly qualified. He worked with MD Anderson Cancer Center in Houston. He was a medical director of the MD Anderson Banner in Phoenix.
Oh, wow.
And so he is a breast cancer expert. So our top 2 cancers in this area in Mojave County happens to be lung cancer and breast cancer. So
we're going to have the top 2 experts in Mojave County working here at KRMC.
I believe so, yes.
Wow.
And to complement the chemo side, we of course have Dr. Van Tile and our radiation.
Yeah.
And so
Dr. V's very cool, very, very smart man, and he's had one of those really exciting lives too, and we're lucky to have him. So we've got a great team we're forming over there, and it's a lot of great things happening. So if you get diagnosed with cancer, obviously your medical provider will walk you through that process of getting you referred over to the cancer center. So if they have any, after the diagnoses, that's when you guys would take over from there. I think what we'll do is we'll take a short break. We'll get back to you after the break, and we'll talk about some other stuff going on with the Mayo Clinic and other projects you've had a chance to work with at KRMC.
Okay.
All right, so stick around, guys. We'll be right back after this short break.
That when someone is diagnosed with cancer, they don't feel they have to leave chemo.
Hi, welcome back to Your Health Matters. I'm Scott Kern. Today I'm here with Steve White, the director of our KRMC Cancer Center. Steve, thanks for being here with us today. I really appreciate it. In the last segment, we talked about all of the partnership stuff we have going on with Mayo Clinic and the Cancer Center, which is really exciting. It's cool that we have them as a resource to help our doctors who are leading experts in lung cancer and breast cancer in the area, which is really, again, another exciting feat to have. Partner with them on any case that we might come across that might be out of the ordinary, or even in the ordinary cases for that fact. But one thing we talked about during the break is the patient experience once you get diagnosed with cancer. Can you speak to, from a patient's perspective, like what the process is for them once they are referred to your program?
Certainly. Once a patient is diagnosed with cancer, we'll set up a initial visit. It's longer than a normal visit because the doctor will take longer time to go over the specifics of your cancer with you. And we have specially trained people who will provide you education on that type of cancer. And we will, working with we talked about earlier, our Mayo network, we have access to all of their educational materials that they've already developed that we can use to educate our patients on specific types of cancer. And one of the things that intrigues me most, they call it survivorship plan. And we will be able to give each patient a survivorship plan for their specific type of cancer. So I think saying the word survivorship gives everybody a positive.
Yeah, it leaves them on a positive note. Now,
and
I'm sorry, I don't mean to stop you, but to speak on to ask a question about the survivorship program plan. Can you talk about what's in that plan, or like just a generalized one? We'll say if you.
What will be covered in the plan is how we're going to treat your cancer. Are we going to do it with chemo, or are we going to do it with radiation? And what the regimen is going to exist, how long, how many times a week, and what you're going to experience. Is it going to make you sick? You're going to have some side effects. We have nurses who are specifically trained to go over the specific chemo drug that you're going to be receiving, because every cancer has different chemo drug. And we also have a very kind social worker. If you have any issues with home life or pet life or whatever, he's there to guide you through and to help with whatever you may need.
Talk about Joe Stevens in that case.
I am.
Joe is fantastic. We've had him on the show before, and he's really probably one of the sweetest guys you'll ever meet. And you're right, he's the ultimate social worker. You guys have a great asset there to help the community. And
Yeah, he clearly living our mission of compassion and commitment.
Absolutely.
To our patients. And when Mayo was here, the one question they asked before they left was, what do we see as the outcome of our relationship with their knowledge sharing? And what I told them that I would like to see is that when someone is diagnosed with cancer, they don't feel they have to leave Kingman.
Mm-hmm.
They feel like we've got the appropriate program, and I believe we do,
Mm-hmm.
to care for them. And the family doesn't have, you and I were talking on break, go to Phoenix, go to Vegas. Everything can be done here.
And that's huge. I mean,
And
we're a growing area.
Yeah.
And even being, in Havasu or Bullhead or, Needles, a surrounding area, to be able to come to some place that's less than an hour away
Right.
for your treatment, that makes a huge difference in having to go get a hotel room, wait at night, because nothing's worse than...
Extra cost.
Absolutely.
Yeah.
So it's even from I guess a global cost-effective standpoint for an individual, if you get the unfortunate task of being diagnosed with cancer, you can stay home and we can help you treat it here.
Exactly.
And you have the comfort of knowing that we've got some of the best physicians, and we're partnered with the Mayo Clinic, which can help us with the best care possible for you.
Right.
So the survivorship plan it's a great word for it. You're absolutely right. It's something that I think we can really hang our hat on at the end of the day, is that we're giving the patient every best possible option
Right.
that for their healthcare needs.
Exactly.
So to kind of change gears here for a second, how long have you been in healthcare?
I started out in a long time ago as an X-ray technician.
Really? In the military or after the military?
Before I went in the military.
Okay.
I was a corpsman and an X-ray tech in the Army for a few years, and then I went to officer school, and I spent the next 20-some years in logistics. But I kept my X-ray registry up. When I retired from the Army, I went to work for a hospital in Tennessee and running the radiology department. And then I moved to Summerlin in Las Vegas and actually helped open the Summerlin Hospital there. And I was their team leader for ancillary services.
Oh, fantastic.
And I saw this nice little ad in the Healthcare Executive magazine, and it was for a position in Kingman. I said, I think I'll apply. And so I sent my application and resume, and Brian Turney, who's still the CEO, called me. We had a wonderful talk, and he invited me over for a visit. And the first person I met was Hy Johnson, who was our board chairman.
Oh,
yeah. And that was it.
That was it. That was back in the 90s.
98.
1998. Wow, I don't want to date myself, but I was still in high school in 1998. That's pretty impressive. So you joined us in 1998. So you said you were in the military for 27 years.
25.
25 years in logistics. So you have plenty of planning and understanding of how to put all this stuff together. So that explains why you were the first person to help us out build the cancer center, and why you're helping us this next transitional phase here.
Right.
And that's pretty exciting stuff.
Yeah.
I mean, I have to tip my hat to you on that one, and just ask, as we grow, you mentioned that we have potentially the need for another linear accelerator later on in the cancer center. Now, when you talked about that's for the radiation treatments.
Correct.
Can you talk about the gamma gun? Is that what it's called, or the machine they use to do the radiation, or how they?
It's called a linear accelerator.
Linear accelerator. I think I've just watched too many comic book movies for.
And that's not my best modality, but the technology has advanced so far that we can pinpoint more accurately a beam that will hit the specific spot of the cancer that we want to radiate and not damage the other parts around or the skin like it used to burn. And we have 3 really good radiation therapists. And we have, of course, Dr. Van Tile, who is our radiation oncologist, and we have a radiation oncology nurse. And and we also have a physicist. And the physicist's job is to actually plan the dosage and plan the regimen that the patient is going to go through. And they do that with, we have a CT, a CAT scan machine, X-ray, and they do what they call a simulation of the treatment on a simple CT machine before you go into the accelerator. And the physicist will put together a plan. The oncologist will review it, approve it, and then the patient starts receiving their therapy.
Is it fairly common? Well, the linear accelerators aren't common amongst hospitals. They're not in every cancer center, are they? That we in the West Coast, or?
Well, I think that the major medical centers that have a cancer center will have comprehensive. When you say comprehensive, we mean both chemo and radiation. But there are freestanding medical oncology clinics throughout separate communities, and where patients can receive chemo
and radiation therapy.
And they would refer to the nearest radiation oncology center.
It's pretty neat to have an actual physicist. When you say the word physicist, you automatically think a college professor or someone to that fact that's thinking about things in space and movement and matter, not helping create programs for cancer treatment. That's really exciting to know that we have that kind of intelligence level to match with our medical intelligence too. It's great. And Dr. Van Tile, like you said, is very good at what he does, helping set up the plans, the radiation therapists.
Exactly.
I know I've taken one of my jobs here is to take school kids on field trips through here. We go to the cancer center a lot, and they always love to see that room because your people just do a great job explaining how everything works, and they show them the masks that the people have to wear and how they point the radiation piece right at it and how it can penetrate certain levels. And it's very exciting to see. And once again, and I can't harp on the fact enough that we have it in our backyard.
Exactly.
And it's here, and we have the means to get you there. If you can't have you don't have transportation, we have a van.
We'll come get you.
We'll come get you to make sure that you're okay. And there's a lot of other services that we can do that with. And I think the community is very appreciative of everything that your department is putting together and moving forward with. Now, I know in your time here at the hospital, you've done a lot of other projects. Can you kind of mention some other ones you've worked with us on over the years? Because I know I've been a part of the hospital off and on since I was 17 years old. So I know I've seen you wear a lot of different.
Yes. I know your mother well. I was fortunate to be, like I said earlier, facility management, and was very happy to be part of building the Golden Valley Medical Clinic, where we have Dr. Zagara and his nurse practitioner, Liz Smith, out there. And that's been a very successful clinic for people who live in Golden Valley. They don't have to come. They also see a lot of people out of Bullhead. And we were also, I was involved with building the outpatient imaging center and the women's imaging center. I was part of the team that put in the first large MR magnet. We called it a 3.0 Tesla and magnet, and that was I think we had the second or third one in the state.
Wow. So you've really done it. You've really put your fingerprints all over KRMC as we've really grown over the past 15 years.
I like to tell Brian that I feel like I'm part of the walls of this place.
I think you have every right to say that you're part of the walls, because you've done a tremendous amount of help to this organization and really helped us take it to the next level as far as patient care. It's having stuff like the imaging center, having a facility like Golden Valley out in Golden Valley, that's so helpful to the community, because that clinic helps keep the ER patient levels normal, so you can stay out there and see an urgent care nurse out there, or urgent care out there, or just see a regular practitioner.
Right.
So I think it's a fantastic program, and I look forward to seeing what else you're going to do. I know you're looking to retire at some point here, but I don't think the hospital's going to let you do that, whether you want to or not. No. But I want to thank you for being on here today.
Okay.
It's been a fantastic show. We've learned a lot. Thank you again, Steve. If you have any questions about the Mayo Clinic partnership with the Cancer Center, please call the Cancer Center or your medical provider. Thanks for watching today's show. This is Your Health Matters, and I'm Scott Kern. Have a great day.